Hello viewers, I am Dr. Sirisha Reddy, Senior Obstetrician and Gynecologist from Avira Hospital. Today I would like to talk about PPH. PPH is nothing but postpartum hemorrhage. It is of two types, primary PPH and secondary PPH. Primary PPH is said to be when PPH occurs less than 24 hours is said to be a primary PPH. And secondary PPH, when PPH occurs after 24 hours and less than 6 weeks post-delivery, it is said to be a secondary PPH. So PPH, when you say it is a PPH, when the blood loss is more than 500 ml in a vaginal delivery or more than 1000 ml in a cesarean delivery is said to be a PPH. So what are the causes of PPH? The main cause of a primary PPH is atonicity. So that is called as atonic PPH. Today in this modern world, PPH stands first in the maternal mortality. So that much important is the PPH, and in diagnosing PPH in the right time and treating accordingly is much needed for this condition. So primary PPH, the most important cause is atonicity. So atonicity is inadequate contraction of uterus after delivery. So it can be due to the most important cause for this atonicity is overdistension. So overdistension, it can be due to a multiparity or a multiple pregnancy, a polyhydramnios, a big baby, or then it can be placental causes. Placental causes, the placenta lying in the lower segment, that can be a low-lying placenta, a placenta previa, abruptio placenta, or a placenta accreta. So all these causes leads to a inadequate contraction of uterus. When there is an inadequate contraction of uterus, this condition leads to PPH. So the treatment for this condition is use of uterotonics. So the four most important uterotonics used nowadays is oxytocin, then methergine, then prostaglandin, and misoprostol tablet. So when all this medical treatment fails, then we have to go for a surgical treatment. So it is a hysterectomy, removing the root cause to stop the PPH. So the next, so once this PPH is not properly treated, patient may go into a hemorrhagic shock leading to death. So everyone has to be aware of this condition and promptly treat this condition. Thank you.